probably my least favorite.
How about your experiences? Where have you gone? What have you done?
Yes. 2 days ago.
Who's it at? 2 days ago. Yeah? Want to talk about it or not?
Yeah, kid was dead. We got there.
Secondary two?
Child abuse. You guys will see it in the news now.
10-month-old.
10-month-old. Mom thought she had a trusted babysitter. Babysitter's cleared through state, yeah. Knew him, family friend. The news is saying last week she picked up the kid and he had some bruises. I said, most of us have kids. We know they fall down, but I don't know. They're kind of suspicious. Not to delve too much into it, but just listening to the mom's story when she was talking to PD about it, it was kind of, it's almost one of those things where she didn't really have a whole lot of options, but that was pretty much the only option she had for the child care. So can't fault mom really. But yeah, just sucks.
I had one last month. It was 6-month-old. Dad did it. We had been there earlier that day, and the mom had called, and she had said, baby's vomiting, and she fell off the bed, she's vomiting. We'd taken her up to the hospital, and we didn't suspect abuse then. The dad wasn't home, and the mom just said, I was changing her diaper, she fell off the bed, she didn't have any bruising or anything at that time, and she was crying, she was alert, and the hospital didn't suspect anything either. He said, she's fine, she fell off the bed, you're concerned mom, mom's really young, she's 19, and sent her home. We went back, it was about 3 hours later. Baby was completely lethargic, vomiting, and we took her back. She had a linear skull fracture. She had 2 broken femurs. Her arms were both broken, but they showed old fractures as well. We ended up transporting her after that, code 3 to Harborview. I don't know if she made it. If she did, it's going to be a miracle because it's really bad. But the dad ended up coming forward and saying he did it. And then the mom in the ambulance was like, I knew this was happening. And we had to be like, you need to stop. You need to stop telling us because we have to say this. And as soon as we got to Harborview, CPS came and took mom.
Okay. Thanks, Jeremy. Anybody else that want to talk about it? If you don't, then that's fine.
I don't want to talk about the child and more through after.
Yeah, go ahead.
Devastating.
Yeah.
No, it's just, you get back, it just changes the whole front.
Yeah.
You have to, like what you were saying, you have to listen to the parents that make these excuses that it's all bullshit in the first place. And you can't do anything. Just get frustrated.
Pretty tough stuff. And it's always easy to kind of weed through CPS and that whole legal system, isn't it? That's clean cut, right? So do you know the incidence, the percentage in terms of kids that go back into a home after they've been reported? Go ahead.
So a few years ago, my wife and I were licensed foster parents, and we went through all of that training, and it was really just overwhelmingly shocking to me, just exactly what parents can get away with. And the basic number they gave us is parents can basically do some pretty despicable things to a kid. They can become non-compliant, and they can remain non-compliant for 3 years. And if at the end of that 3 years, they show just the slightest bit of improvement, it resets the 3-year clock. So this can drag out essentially indefinitely.
Why is that? I mean, is it CPS being lazy, not doing the job, or what is it?
It's because there's a lot of research they said that shows that, assuming the parent does make a turnaround, that children tend to do better in the long run if they're able to be restored to their biological family. But unfortunately, like we can all kind of figure out, it's like how many years of trauma do you want to put a kid through?
Exactly.
Parents wait to shape up.
Exactly. And so the frustrating side of our thing is that we see it, law enforcement sees it, we turn it over, we do the right things and reporting, everything else like that. And like you said, 9 times out of 10, they will go back into the same home over and over again for the same thing, and we stand there and shake our heads. But it's a legal system, like it or hate it, it's a legal system in terms of the way it works, so.
My friend's a RN at Deaconess.
Yeah,
And she has, a baby from birth, and she still has her, I think she's 25 months, but she was a meth baby. So she has her, and there's a couple other nurses at Deaconess that has her siblings, that they actually got adopted and stuff, so,
yeah.
right now she's in English, she might have to give the baby back to this mom that's gotten the previous kids taken away, so,
Makes no sense.
yeah.
So let me ask you this, and then we'll dig into this thing. Those of you that have walked into or been involved in child abuse cases, as you go into the house, what are some things you remember, not in terms of specifics to the call, but what are some things that you remember in terms of the environment and everything else like that? Okay, that's a commonality in terms of a other type of house.
Not saying much.
Tension, yeah, say again?
Not saying much.
So quietness, okay, absolutely. What else do you hear?
Not a lot of separation.
So,
other
sometimes,
than anger, not.
Right.
a-
right, and I've seen full gamut in terms of, in terms of one versus the other, in terms of spouses or significant other. So sometimes it's crazy in terms of unstable scene.
Or like separation, or they'll try to talk a lot, or right over top of you and give you stories and stuff
Yep.
while you're working.
I felt like that
Been
one
there,
was
done that.
making 1,000 excuses, like talking too much.
Yep, yep. What else?
I think as a crew, we're a lot quieter, and it seems like we are getting real quiet.
Yep.
And we're just listening
Yep.
to the person.
Yep. So I don't know about you, but I can think of several different types of calls, and I remember one specifically in Post Falls where you called an unconscious 2-year-old. Get there, and it was the so-called typical boyfriend that was watching the child. Walk in, and mom's in that corner, boyfriend's in that corner, law enforcement is doing CPR on this child. And so, as you said, you walk in and you're like inundated with this thing, right? Pick up this child, 30 seconds later, we're out. You know very little story about what was going on, but enough to the point that you ran with it. And so the idea that you're going to get a lot of information into this, if you haven't been involved in this, I hope you don't have to, if you do, you're going to get hit with a whole lot of information post story. So it changes ever so quickly in terms of possibilities. This is old. I'm sure those numbers are extremely old in terms of the possibility of what's out there. This is 3 million children suffer each year. 5 children a day die. Victimization is somewhere around 12.3 to 1,000 kids. That is like crazy high. The most prominent time, you should know this, most prominent time is somewhere between newborn and 3 years of age. Most prominent time. Why is that? Kids are crying, stresses are going on. Our kids cheap to raise, right? And so there's finances, and so the list goes on and on, by far. And then if you add special needs, as we talked about last hour into this thing, it just adds it up.
This is just, United States.
I'm not sure in all honesty if that's worldwide or just across the United States. But the 0 to 3 is kind of across all the places, John. They are victimized at a rate of about 16 per 1,000. So 1,500 children die each year.
Now, this is every day 4 fatalities, what's the difference between that one and the 5 on?
Yeah, I was just looking at that. I don't know. So while it can occur from infancy to age 18, typically the physical abuse is somewhere between 0 and 3 years of age. Sexual assault can start as early as 6 months of age and go through teens and well into teens. And so the idea in terms of figuring out, we are at a huge disadvantage. When was the last time that you have done anything with formal training about child abuse? You do it routinely?
I don't know if I've ever had formal training.
Check. So the idea in terms of we don't get the education that we need. We get thrown into a situation that is at best in a conflict. At worst, you can't even walk into the scene because there's so much stuff going on. And so it's a setup for disadvantage to us. It goes back to what Charlie was saying, is post this, and what Justin was saying, post this, and we get hurt by it. We get hurt by it. It transcends gender, race, age, social, and economic status. Has anybody been in a rich person's house with child abuse? These kids have long-term health care issues, and not only because of the abuse, but because of neglect. So it's not abuse, it's physical abuse by itself, it's neglect that goes along with it. So not only do they have the physical abuse, but the neglect of what's going on. So health care is non-existent. The pattern of abuse and assault forms the cycle. It's difficult to break. So this thing right here, this is the crazy thing right here. The idea in terms of the person that's doing the abuse, 75% of the time will abuse themselves. If you want to take a look at it from a socio-economic side, check out the prisons. They're filled with those that were beat up and abused and everything else like that. It doesn't justify it. Doesn't justify where it came from, but that's part of it too.
That's not a scaffolding thing.
Yep. So from a terminology standpoint, intentional, physical, or emotional injury at the hands of parents. Parents who harm each other are more likely to abuse their children, so domestic dispute is a setup in terms of child abuse. And it's not always the male that's part of that. It can be both sides. Law enforcement is not always present, meaning you may be the primary and walking into this thing. Isn't that comforting, you know? And you've probably already been there as well. You have a responsibility to identify the victims, initiate some kind of action. So the idea of leaving that child in the house, how do you do that? You're not taking my child. How do you do that? Law enforcement. That's part of it, law enforcement, yeah. What else?
You can report it.
Say again?
You can report it.
So the idea that if you don't transport him, you still report it as a possibility, right?
You don't even have to report it to, I mean, you report it to the hospital, but you can report it to DSHS as well.
Report it to who? Because that never works. I think fire has maybe more than AMR.
You can report it as a non-reporter or as a,
But I think John's standpoint is that yes, reporting is one thing, but they physically would do anything about it is something else. I think that's a good point.
The hospital itself is one of the best resources.
Right.
To take
And I would agree with that. Okay? But again, back to the incident. What do you do with this kid? Can you take him?
Say that again?
Can you take this child? Parents don't want you to take him.
If they don't know the situation.
Huh?
Depends on the situation.
If the child's not safe, then I believe we can.
If your child has life-threatening injuries, I believe you can take them.
So how do you paint that picture?
What do you say?
Life-threatening injuries. Your child has life-threatening injuries. I think your child's got some serious injuries that we need to have checked out at the hospital. I think they're really going to be life-threatening along the way. Paint the picture. Are you flat out lying to your feet? Yeah. But the idea in terms of making that happen. To what we're talking about. From a legal standpoint, that's kidnapping. You take your child, just flat out take him to the hospital, that's kidnapping, okay? And it will be you that take the hurt on that.
But like you said, you can just grab and go. You can make
Depending on, right?
to get yourself out of that
Right.
situation. So how are you able to just scoop and go without really saying anything? With, you know, in that regard?
Sure,
Is
sure.
Does that mean that the parents aren't fighting you to keep the kid?
Right.
You can grab, scoop and go?
The,
or what?
the situations that I've had to where they're seriously injured or seriously sick, based on this, I usually don't even stop. I'm just communicating on the way out that I'm taking this child to the hospital, and it's story. And law enforcement, like in my case, law enforcement has been on scene to back that up. Okay.
So my partner and I did this the other day. We were called for, an 11-year-old has called and said that he had a stomach ache, and it was a weird call from the beginning. And we showed up to this house, and the grandma met us outside.
Yep.
And said, the mom has mental illness and has been hitting him. He's not sick, but you need to figure something out because she's not gonna let me near him. We called for PD, and they showed up, but she was threatening us with, she had weapons inside the house and stuff like that. They got a hold of her, but when we were able to talk to him, he wasn't sick, but she had been abusing him, and he said, I need out of this situation. We had to paint the picture to say, you know, he's extremely sick, he has these injuries, and she believed us enough to where we were able to take him. So we did exactly that.
Yep. But unfortunately, that's what you gotta do in a lot of cases, or in some cases. So 60% of the time, the person that's being abused knows the person that's abusing them. So it's not like a phantom stranger or anything else like that. It's well known to the kid. And sometimes it's multiple abusers in terms of doing this.
I don't understand that statistic. I mean, if somebody's putting their hands on your kid, I mean, it's not like somebody in the mall randomly walks up and slaps your kid. I mean, it seems like that would be 100% of the time.
So what they're saying is there's another 40% that's out there for some reason. I'm not sure where they're going with the rest of that. Okay. This is even worse in terms of the possibility of sexual assault that's well known to the person. It's not like a danger stranger or anything else like that. Three elements of child abuse include the child, the abuser, and the stressor. The child, the abuser, and the stressor. So again, it never justifies the child abuse in terms of stressor, but the idea that there's always going to be something that will trigger it. And it makes no sense. I mean, in a rational mind, it makes absolutely no sense to us, the fact that they're beating this kid because they're laid off. But that is an example of a stressor that kind of creates all this. So it goes on and on. Highest risk of abuse. Preemies, we talked about last hour. Multiple births for the same reason. A whole lot of responsibility and a whole lot of stresses that come along with it. Special needs. Autism is an example of that. We're going to get into autism, as I mentioned this morning. Not gender parented wanted. I want a girl or I wanted a boy, or vice versa. And some sort of a crisis.
How about blended family?
Yeah, and that's not into this mix, but you're straight on with that. These days about blended families. Types of abuse can be physical neglect, emotional, and sexual abuse. You should know 4 different kinds. So, as we walk through most of this, I'm guessing you've already have seen it or know about it, so I'm not going to spend a whole lot of time, but at least slow down and talk about it. Soft tissue injuries, common indicators, so multiple bruising. And so the so-called bruising in various stages. And it's like we were talking about earlier, the idea that you look at as kids and kids get bruised. I mean, if you had looked at my 3 sons at 2 or 3 years of age, it looked like we had beat them. When in reality, they were being boys 2 or 3 years of age. So the idea that they were covered in bruises, and yet the so-called various stages of healing is typically, not always, but typically we're talking about lower back, butt, and into the thighs. Okay? that are key places in terms of that. Defensive wounds on their hands and forearms and symmetrical injuries such as bites or burns. So the idea in terms of the child coming up and doing this type of thing, you're seeing some sort of marks in terms of here or here, because they're trying to defend themselves. Same thing in terms of caregivers fighting on arms or legs. Okay, all possibilities. Burns is the other thing that's here, and specifically cigarette burns. So, you remember this. This just talks about the fact that as time goes on, as you already know, in terms of somebody with bruising, it's going to start from here and end up here in terms of this yellowish, brownish type thing. And all it's talking about is over a period of days it's going to take to get there. And so the so-called various stages of healing is kind of this. Burns, uncommon locations, soles of feet, palms of hand, back, or buttocks. Why the buttocks?
Because you can't see it.
What was that?
Dipping.
Dipping. What about dipping? What do they do?
They dip them in hot water and they lift their feet up with a reflex and their butt hits the water.
Right. So the idea that they can keep dumping them in the water so that initially they're going to have some burns in the bottom of their feet, but the idea in terms of continuing on with hot water is on the butt. And so you'll see the bruises up on the lateral side, up to the top of the butt and the lower back. Okay? Are all possibilities. And that's where you need to do them. And they can be partial thickness, they can be full thickness, depending on how hot the water is and what the burn material was. So this so-called splash burns. So if a child, the story is that the child pulled a pot out from the top of the stove. Well, number one, how old does the child have to be in terms of reaching up to the top of the stove? We're talking about probably 2 years of age, 3 years of age, something like that, to get up there. So the so-called splash injuries is that splashes them kind of all over the place. Versus this, that is this predominant area on this back area. So it's not spotty, if you will. It's a continuous type thing. Consider the possibility of physical abuse if you hear conflicting stories. We just got finished talking about it. The idea that you get a bunch of different stories depending on who's in the room. Hovers over the child as being overproductive. Sarah was talking about that. Describes the child as evil or in some other way, negative way. Have you had that? Have you had them walk in and say that child is the evil one? I've had that. Has a history with law enforcement. Has a history either of abuse or criminal or something along those lines that law enforcement knows the address well. And maybe you do as well. Consider the possibility of child abuse when the child has unexplained burns, bruises we talked about, fading bruises we talked about, shrinks at the approach of adult in general. Reports injury by a parent or another caregiver. So where is this most likely to happen? Right here? What was that? School. So school is probably where you hear about the most. And so sometimes you'll get pulled in by school authorities for it. Possibility of physical abuse from the child. Must have been a drug, I put that up there. When the child has repeated responses to the same child or family, malnutrition, failure to thrive, sometimes is associated with child abuse. And we're talking about last hour. Story by the parent doesn't match the injury, indications of the scars, past burns, etc. How much does it take? How much force does it take in terms of creating a fracture for somebody under 2 years of age? Well, yeah. So this pliable type hold that we talked about later or earlier in life. The idea in terms of to get to a fracture, there has to be a substantial amount of force that makes that happen. Does that mean that you can't have an 18-month-old that has some sort of injury in terms of fracture? No, that's not what we're saying. We're just saying you need to at least think about the possibility based on your assessment finding. Identification of abused child, often on the skull, nose, facial features, upper extremities. Same thing in terms of fractured ribs. You need to be highly suspicious in terms of somebody with fractured ribs. With a child it is. Head injuries claim the largest number of lives among abused children. Account for most long-term disability. So while these kids may survive the abuse, their cognitive function is gone just based on whatever the injury was. And we'll kind of explain that a little bit later on. So shaken baby syndrome. Has anybody unfortunately been on the scene? Anybody know what it is?
When they shake like that and the baby can't hold up their head because they got fat head syndrome.
Mm-hmm.
And their neck can't handle that.
Mm-hmm.
Basically whiplash.
Mm-hmm. Okay. So coup contra coup type thing. How long does it last for?
Permanent.
If you don't stop crying, I'm gonna kill you! 5 seconds. 5 seconds. 5 seconds of this. I've had a child kind of similar to what you were talking about. I've had a child with bruises on the arms to where they did this and this. So what happens? Subdural hematoma, brain swelling. How do you know? How do you know that that was the mechanism? I'll let them tell you. So one of the things about this, seizures, very, very common. Petechia about the eyes, and you may or may not see it on the pre-hospital side. It's one of the things they'll take a look at that when they get in hospital. Petechia, or is that blood vessels that are broken about the conjunctiva, is very, very common with shaken baby.
What was it with you guys?
It's called petechia. P-E-T-A-C-H-I-E. Petechia. So the degree of brain damage is as to how long they've been doing this shaking motion. On average, it's around 5 seconds. So I've heard cases of 15, 20, 25 seconds. The one case that I was telling you about, to where it walked in, child was unconscious and CPR was going on the floor. As it turns out, boyfriend had done a shaken baby on this particular child. This was not the one to where he swung out the legs against the wall, but shaken baby, and promptly went and laid the baby down in the crib. And of course, the child's unconscious at this point. Goes back in sometime later, could not get the baby up, and child starts seizing, and then goes into cardiac arrest at that point. And so the idea in terms of that was over a period of about an hour to hour and a half, somewhere in that neck of the woods. So the idea that it's going to happen within a matter of seconds to get called for this thing, not necessarily, and especially to where they're trying to hide it from you along the way.
Do they autopsy all these kids?
Yeah, yeah, they do. As a criminal thing, they do. 20% fatality in the first week of injury. Mean age is about 9 months. So again, these kids are, by 9 months, you've got a kid that's pretty good size that you're doing this type of thing on. And so the bruising will be evident over a period of time on the back and the legs and that type of thing.
Gary, what is going to give you kind of an index of suspicion between this and SIDS? Like if they're calling you that much.
Great question.
Just like I went in and.
Excellent question. The idea in terms of SIDS, to where you go in and they're already dead, you may or may not know, and so you're going to just have to put all the clues together about the possibility. I would love to tell you there's a clean way of saying this is SIDS versus this. It's not always clear.
I've seen them call a lot of things SIDS, like when mom rolls over on the baby, they'll just call it SIDS, and it's not SIDS.
SIDS is by exclusion. It's kind of like excited delirium that we talked about. It's by exclusion, where they can't find anything else along the way. But the thing about shaken baby syndrome in an autopsy, is when they will try to figure out whether or not we're talking about shaken baby syndrome, because you'll see the petechia, you'll see some other things in terms of brain trauma as well. And that's part that it's not going to help you. It's not going to help you in terms of walking into this, but in terms of autopsy is where they'll figure that out. You're right, Lee. I mean, it's all over the place in terms of what SIDS may or may not be. We'll talk about that next week as well. So unknown as to incidence each year. Why? I mean, it's like, I created shaken baby syndrome. Yeah, doesn't happen, right? So the idea statistics are well undeveloped. We don't know exactly what they are. So check this out. You can have repeated episodes in terms of shaken baby syndrome. It doesn't mean that every single time that you do this, end up with a subdural hematoma, okay? Worst case is yes, but the idea that the abuse can go on and on and on to varying degrees.
Seems like that's just the last time,
Yeah,
you know, that's when they.
right, so they get to the point of that. But check this out, if we're talking about somebody less serious, might there be reasons as to why my baby is not eating well? Can be 14 different reasons for it, other than this. Can there be reasons as to why my baby is irritable? Yep. Can there be reasons in terms of decreased muscle tone outside of shaken baby? Yep. So this is kind of like the CO. Remember we were talking about CO poisoning that can mimic many other things along the way? This is kind of the same thing. This is why it gets missed sometimes. If I'm seeing a kid with posturing and rigidity, I'm not necessarily going straight to shaken baby syndrome. I'm always thinking about a head trauma, but for various different reasons. To include respiratory distress and seizures and fontanelles. So let's talk a little bit about fontanelles, and you'll get into it next week as well. The so-called soft spots, there's an anterior soft spot that sits here, and there's a posterior soft spot that sits right here. This one closes up with about 6 months of birth. This one is open for 18 months. So next week when we're into pediatrics and we're talking about reasons for a bulging fontanelle, one of them is because intracranial pressure, increasing intracranial pressure associated with this right here. Okay, that's just one of the many different ones. Those with milder cases tend to have less defined outcomes, i.e., learning disability. So they go through a time of this, and good luck with how it turns out for you. Identification of the abused child can be because of blood force, obviously. Can be because of drug abuse by mom during pregnancy. Talk about that. Can be because of long-term problems through withdrawal. And I mentioned this earlier. Fetal alcohol syndrome is just horrible. It's nasty, nasty. I hope I never have to see that again in a child. So the preemies, the crack babies, the babies that are going through withdrawal if mom are allowed to keep them, and in most cases they're not allowed to keep them once they're hooked up on cocaine and meth and the like stuff. In most cases they're taken away from them, but it doesn't mean that it's any easier to deal with that baby. They go through seizures, they go through withdrawal, they go through developmental problems along the way. And so there's all kinds of issues that surround these kids. So I'll let you write and then we'll talk.
Yeah, that was to say, it developed a huge what? Oh.
Cocaine withdrawal. Signs of neglect.
That last one sounds like my son. Well, that's what I'm saying, 17, man, I get that, I take a shower now.
Sometimes they never grow up. Some more signs of neglect. You don't need to know each and every one of these, but you should have a general idea in terms of telling me about how a child looks with neglect. Emotional abuse. So the idea in terms of caregivers, parents, whoever, abuse the child just by emotionally going through either neglecting them or purposely abusing them through the way they treat them. And so it can be a whole lot of different things, to include isolation. And that's one of the big things about emotional abuse, is that you take them out of an environment, out of a social type of environment, and you put them into this isolated thing. These days, with bullying that's going on, you hear about bullying, especially in the school systems. The idea in terms of kids being bullied enough to decide to take their own lives based on that. That's very, very real. That's this, and then some more, if you will. We've kind of talked about this, the child's reactions in terms of how they're going to come about. School is an issue in terms of their performance, but it's also an issue in terms of their behavior. So school officials will kind of get alerted based on whether the child's acting. The parent that's involved will rarely look at this child, and they generally will not do a whole lot of eye contact with each other. The parent especially will consider the relationship to be negative. I wish I never had to. Signs of sexual abuse. I'll do right and then we'll talk. So if the rest of child abuse is secret, this is even worse in terms of possibilities. And so you can walk through an entire scene and not know with certainty what is going on. But I don't know about you, but when I've been in these situations, it's just like the hairs in the back of my neck just kind of stand on edge for the possibilities. And hopefully you'll get that same gut reflex for what you're walking into. This, unlike some of the other things that we're talking about, this is where parents, significant others will get charged with felony abuse. So looking at the environment, checking it out. Is there something going on with mechanism of injury? Is there something going on in terms of abuse that you see, as far as the instruments, such as straps, such as belts, such as whatever else it might be? When did the injury occur? So you can put your time thing onto it. And that the story doesn't change along the way. And the idea that you don't have to be a neat freak in your house, but what they're talking about is that certain things along the way can be a setup for immediate danger. Is a child failure to thrive, too thin? Are they dressed appropriately? Have you been on a scene to where mom wanted a boy and dresses the little girl up in boy clothes? So it can go both ways. It's important acceptable for the age. Child's hygiene, talked about. Object of abuse might be a belt.
You gotta be careful with that.
Absolutely. There's no assumptions. And again, the idea that you walk in just because you see a belt, that's the object, not necessarily. But what we're pointing out is just the possibilities of taking a good look at the scene. That's more than anything else. So to this, the idea that when you walk into a house, and you've been there, I'm already preaching to the choir, but when you walk in the house, you're kind of surveying in terms of what's going on around you. How are they interacting together? Are they screaming at each other? Or do you think they normally get along with each other? Do you feel the tenseness in terms of walking into the scene? Are the caregivers willing to provide information, or are they apprehensive and withdraw from it? Do the stories change? Do they match? Are they consistent with the clinical findings? The idea in terms of falls, so-called falls, is one of the things you need to consider. Was there a delay in seeking medical care? So were the obvious so-called bruises in various stages of healing? Was there any medical care anywhere along the way? So, just a word about this. The idea that there's certain cultures that would do certain things for the kids based on their beliefs. And so, there may be various things. I know that when we went into Native American communities, there was various things they did with their kids that nobody else had heard about. This, for example, is just an example in terms of looking at bruising on a child versus so-called Mongolian spot that the kids are born with. So this patch right here, again, is a birthmark. Strawberry mark, again, a normal birthmark. There's, have you seen cupping? You know what I'm talking about with cupping? I think it was back in last summer, Michael Phelps, they talked about cupping, and it was one of the things they would do in terms of pulling out toxins. It's especially common in the Far East, and they end up taking like some hot cups, and they put it on the lower part of the back, and when in the end it creates bruising, but essentially what it's about is bringing toxins back to the surface. And so cupping again is another way that you'll see bruising in kids. So let's kind of slow down and just check this out a little bit. Do not accuse anyone in the field. Easy to do. Again, keep your cool. Just chill out in terms of pointing fingers, even when you know. Treat any underlying injuries in accordance with your protocols. Obtain information in a non-judgmental way. This is a crime scene, folks. Law enforcement is the lead on this. The idea that you do your best in terms of keeping it as objective as possible. Document, document, document. Document what you saw, document what you heard, document not nearly what you thought about it. Stay as objective as possible. The fact that this comes to court and you're going to sit in and defend your report is not, they're not looking for what you thought about it at the time. High degree of suspicion regarding possible abuse. Ensure that the child is transported. This goes back to what I was talking about earlier. Come up with a story in terms of why that child needs to be transported to all possible if law enforcement can't get it done for you. You already know this, but you have a legal responsibility to report the possibility of abuse. It doesn't have to be confirmed, just suspected. Witnesses is good, especially witnesses your partners and the likes of is good as far as what's going on around you. Let's see. Including information about what you walked into as far as the home. Was it neat? Was it a boarder's place? Was it whatever it was along the way? Describe the house. So in the end, it's on you. It's a setup. Just because you go out for an hour's worth of this, it doesn't mean that everything will be well for you. The idea in terms of walking out of here with this is more than anything else, observing and reporting and doing your due regard. You can't control the uncontrollable, and that is that the legal system will continue doing its thing. And so do your part as far as trying to make this happen, and that's the best you can ask for. Questions at all? So have I shared with you about my story of 18-month-old that took care of